Welcome back. For this week's Purposeful Living segment sponsored by Elder Care Solutions, I'm joined by the segment's creator, Phil Pullman, and an organization supporting aging adults with inpatient and outpatient options. Welcome, Phil. Tell us who you brought in today.
Well, today I brought in Lauren Growley and Mackenzie Pierce. Lauren is actually the director of outpatient physical therapies, and Mackenzie Pierce is a physical therapist in inpatient. Brothers of Mercy have so much to offer, and from skilled nursing to assisted to living, memory care, PT, OT, you name it. If you have an issue, these guys are going to help you. So, can we just start with saying, what's unique about Brothers of Mercy's Wellness Center?
Well, we just celebrated our centennial last year. We've been in business for 100 years, so I think that sets us apart just as is. The brothers actually rode around on bicycles in downtown Buffalo and cared for people in Western New York. And then they eventually came to the property now in Clarence, and it's really expanded. So I think when saying what makes us unique, you can age in place at our campus. You can start at an independent living facility, and then as you need more care, we have assisted living, and then we have the skilled nursing facility. So it's our own little community right in Clarence.
Can you explain the difference between inpatient and outpatient therapy and how a patient can figure out which setting is right for them?
Usually with inpatient therapy, you have to have some kind of qualifying hospital stay, or maybe a family member just can't take care of you anymore and you need more help in a 24-hour care basis. So if you have that, then you would go to inpatient. If you are staying at home and you need therapy services, then you would come to outpatient for an hour appointment, and then you would return back home.
Matt, can you tell us a little bit about what a typical inpatient therapy program looks like for someone recovering from surgery, an illness, or an injury?
Sure. So when they first come in, we get a physical and occupational therapy evaluation as well as a speech screen. And what we're looking for is what they're able to do at their baseline. So this is getting in and out of bed, in and out of their wheelchair, being able to ambulate or walk, what kind of device they need, whether it's a walker or a cane, so we can best kind of guide nursing staff to helping them in their current state. As we progress along, we're really looking towards what they were doing beforehand. We know if they're living by themselves, if they were giving assistance, what kind of environment they were in. So that way we can create our short and long-term goals and help them progress back to what they were doing beforehand.
Lauren, how does your outpatient setup benefit patients, families, and residents on campus?
So we're known for our 5-star therapy. The brothers really wanted to give back to the community. So our outpatient clinic is attached right to the skilled nursing facility. And therapists like Mac, before discharging a client, they will bring them over to outpatient, show them so they can become familiar with the space and with the therapist and really feel comfortable. And then they will make a recommendation whether home health should come first when the person gets home and acclimates them to their house. But we always encourage people to continue their therapy journey by coming to outpatient. It's a little bit more challenging. We're going to work longer term, stamina, strength, and things like that to get you back to your most independent self.
Physical, occupational, and speech therapy all play important roles in recovery. Let's talk about, or if you could share a few examples of how these services really help people return, like you mentioned, to that independent level of living.
Sure. So we all work together closely to kind of get the big picture of what the patient was doing. So we each split off into our little sections from there. So say physical therapy works on walking and getting up on their legs, getting the strength in their legs going, whereas occupational therapy maybe takes that skill and they build it in the kitchen where they're meal prepping or they're making some light meals or standing at the sink and brushing their teeth. And then speech therapy would work towards maybe the safety, the skills, the sequencing part of it, and any swallowing concerns that they may have. So that way we get the whole picture together and get them a safe discharge.
What common mobility issues do you see, and how can therapy help prevent falls? This is something that Phil and I have talked about a lot with these Purposeful Living segments.
Strength and balance is number one, and number two, as we slowly decline, it seems to be after a fall that things really start to tumble downhill. So you really want to get ahead of the game, and if you notice a change, in mobility or in strength, you're just feeling weak, maybe you're dragging a leg, it's time to do something about it. When I go out into the community and I give wellness talks, I always educate on what is the right practitioner for what. Where are you seeking help? And when things like balance or strength are the biggest issues, you're coming to see a therapist. We are the people that are going to get you back into tip-top shape.
For those families who are supporting a loved one recovering from inpatient rehab, what advice do you have for them?
Sure. The most important thing, first off, is just to be present. You know, they've had this major life-changing thing where they've maybe fallen and had a fracture or a surgery, pneumonia, a stroke, and they need that familiar face. You know, they need the people from the community that they know and trust. And then as they get stronger and get better, we can get the family in for some training, and we can work towards taking them for walks, going up and down stairs, in and out of cars for appointments. So that way, when their discharge does come up, it's not a big jump, like, how am I going to take care of myself at home? It's, we've been planning for this all along. Of course I can take care of myself at home.
If someone is wondering whether therapy could help them, what signs should they look for, and how can they get started with a rehab program?
Now is a great time. We're getting together with loved ones, maybe some aging loved ones that we haven't seen in some time. And if you notice that they're having issues getting up and down out of chairs or in and out of cars, or maybe grandma is holding onto walls or furniture when she walks around the house, or your older aunt has to have help getting into the stairs of someone's house, it's time now to address those concerns. Don't let them wait. The first point of contact would always be to go to a primary care physician and discuss these things. As family members, it's often hard to discuss these things with our loved ones. They don't always want to listen. So let us be the bad guys. Take them to the doctor, discuss your concerns, whether it's in front of them or maybe off to the side, and let us do a full assessment and really see what we see and then guide them. They often take it easier from us than they do from their loved one.
Well, thank you so much for coming in and sharing more about this, especially now's the time we're seeing those aging family members like you mentioned, and you guys have the support to help them. So viewers, if you'd like to learn more about the inpatient and outpatient rehab options through Brothers of Mercy, just visit brothersofmercy.org or call the number on your screen. This Purposeful Living segment is sponsored by Elder Care Solutions. Thanks again for coming in.
Thanks for having us.